Prostate cancer is a silent killer. It doesn't show up with loud alarms or flashy symptoms. It creeps in slowly, often without a hint until it's too late. But here's the thing. Your body does try to warn you. You just have to know what to look for. So, if you're a man over 60, or you care about someone who is, this might be one of the most important videos you ever watch. Today, we're talking about the 7 early signs of prostate cancer, the ones most men ignore until it's too late. And don't tune out just because you feel fine. The truth is, many guys with prostate cancer feel perfectly normal until the disease has already spread. So stick around, because what you learn here today could literally save your life. Let's start with a symptom that's often brushed off as just a part of aging: frequent urination, especially at night. You might think that waking up once or twice to pee is normal when you're over 60. After all, the body changes as we age, right? But here's the thing. If you're waking up regularly to use the bathroom, it's not just an inconvenience. It's a potential warning sign. Medically, this is known as nocturia. It happens when the prostate gland which surrounds the urethra, the tube that carries urine out of your body, starts to expand. As the prostate enlarges, it can press against the urethra, narrowing the passage and making it harder for your bladder to empty completely. Over time, this pressure builds up, creating a cycle of frequent urination and disturbed sleep. Dr. James East, a leading urologist at the Mayo Clinic, often tells his patients, if you're waking up more than once a night to urinate, it's your body's way of trying to get your attention. When it comes to prostate cancer, one of the most overlooked symptoms is weak or interrupted urine flow. This might not sound dramatic, but for men over 60, it can be one of the earliest and most telling signs that something is wrong. In the early stages, prostate cancer is a stealthy intruder. It can grow quietly for years without showing any clear symptoms. However, as it starts to push against the urethra, the narrow tube that carries urine out of your body, you might notice subtle changes. Imagine trying to water your lawn with a hose that has a kink in it. The water doesn't flow smoothly. It sputters, stops, and struggles to maintain pressure. This is essentially what happens when an enlarged prostate begins to squeeze the urethra, restricting the flow of urine. To understand why this happens, it's important to know a bit about how the prostate works. The prostate is a small walnut-sized gland that sits just below the bladder and surrounds the urethra. Its primary job is to produce the fluid that nourishes and transports sperm. However, as men age, the prostate tends to enlarge, a condition known as benign prostatic hyperplasia, BPH. BPH is not cancer, but it can cause similar symptoms because the enlarged gland presses against the urethra just like a growing tumor would. This can make it difficult for the bladder to empty completely, leading to weak or interrupted urine flow. But unlike BPH, prostate cancer doesn't just stop at making bathroom trips annoying. It's a potentially life-threatening disease that can spread to other parts of the body if not caught early. Blood in urine or semen is medically known as hematuria for urine and hematospermia for semen. It occurs when the small blood vessels in the prostate gland are disrupted either by inflammation, infection, or in more serious cases, a growing tumor. Dr. Michael Jenkins, a leading urologist at the Cleveland Clinic, explains, when you see blood in your urine or semen, it's like your body hitting the emergency brake. It's trying to get your attention. Blood in urine or semen can occur for several reasons. 1. Tumor growth. As prostate cancer progresses, the tumor can invade nearby tissues and blood vessels, causing them to rupture. 2. Inflammation and swelling. Cancer can also cause the prostate to become inflamed, increasing pressure on nearby capillaries. 3. Disruption of blood vessels. As the tumor grows, it can physically disrupt the small blood vessels within the prostate, leading to leakage. But here's the thing. Not all cases of blood in urine or semen are cancer. It can also be caused by prostatitis, inflammation of the prostate, urinary tract infections, UTIs, kidney stones, bladder or kidney infections. This is why it's so critical to get checked by a doctor if you notice this symptom, rather than just assuming it's a minor issue. When you think about prostate cancer, erectile dysfunction, ED might not be the first symptom that comes to mind. After all, most men associate ED with aging stress or perhaps just a few bad nights of sleep. But here's the reality. ED can be one of the earliest and most telling signs of prostate problems, including cancer. The nerves and blood vessels that control erections are closely connected to the prostate. This means that when the prostate starts to grow uncontrollably, as it does with cancer, it can put pressure on these delicate structures, disrupting the signals needed for a healthy erection. Dr. Matthew Stevenson, a leading urologist at Johns Hopkins, puts it this way. Think of your pelvic area as a complex highway system. The prostate is like a major traffic hub. When a tumor starts to develop, it's like a roadblock that clogs the entire system. In the early stages of prostate cancer, you might notice that your erections aren't as strong as they used to be, or that it's harder to maintain them. You might also experience reduced sexual desire or libido, difficulty achieving or maintaining an erection, weaker or less satisfying orgasms. These changes can be gradual, making them easy to dismiss as just a part of getting older. But if they're combined with other symptoms like frequent urination or blood in your urine, it's a sign that something more serious could be happening. So why exactly does prostate cancer cause ED1? Nerve damage. The prostate is surrounded by delicate nerves that control erections. When a tumor starts to grow, it can compress or damage these nerves, disrupting the signals needed for an erection. 2. Blood flow issues. Tumors can also restrict the blood vessels around the prostate, reducing blood flow to the penis. Without sufficient blood flow, achieving and maintaining an erection becomes difficult. 3. Hormone changes. Advanced prostate cancer can interfere with the production of testosterone, the hormone that fuels your sex drive and powers your erections. 4. Psychological impact. The stress and anxiety that come with a cancer diagnosis can also contribute to ED, creating a vicious cycle where worry about sexual performance actually makes the problem worse. When it comes to prostate cancer, one of the most easily overlooked but potentially serious signs is persistent pain or discomfort in the pelvic area. This type of pain often starts as a dull ache deep in the lower back hips or pelvic region. It can feel like a muscle strain at first, or maybe a lingering soreness from sitting too long. But if this pain lingers or gets worse over time, it could be a critical warning that something is seriously wrong. The prostate sits just below the bladder surrounding the urethra and is nestled close to the pelvic bones, nerves, and muscles. It's also adjacent to the rectum, which is why prostate exams are often done through the rectum to get a clearer picture of the gland's size and texture. As a tumor grows within the prostate, it can push against nearby tissues, irritate nerves, and even invade the bones in the pelvic area. This leads to deep, persistent pain that can radiate down into the thighs, hips, and lower back. Dr. James Thompson, a leading oncologist at the Mayo Clinic, explains it this way. Prostate cancer pain is often misunderstood because it doesn't always feel sharp or immediate. It's more like a slow, steady ache that builds over time, almost like a warning drumbeat in the distance. In the early stages, this pain can be subtle, often coming and going without a clear pattern. It might feel like a dull ache in the lower back or hips, stiffness after sitting for long periods, a sense of pressure in the pelvic area, discomfort while sitting or driving. Because this pain is often mild at first, many men dismiss it as just a sign of getting older, poor posture, or even the result of a long weekend of yard work. Loss of bladder control is one of the most distressing symptoms of prostate cancer. It's not just a minor inconvenience or a normal part of aging. It's a critical warning sign that your prostate health may be at serious risk. For many men, this is the symptom that finally drives them to see a doctor, but unfortunately it often means the cancer has already progressed to a more advanced stage. As the prostate enlarges, either due to benign prostatic hyperplasia (BPH) or cancer, It can press against the urethra, narrowing the passage and making it harder for the bladder to empty completely. This pressure can also interfere with the nerves and muscles that control the bladder, leading to frequent urgent need to urinate, involuntary urine leakage, difficulty starting or stopping the flow of urine, a feeling that the bladder is never completely empty. Dig you, doctor. Michael Jenkins, a leading urologist at the Cleveland Clinic, puts it this way: think of your bladder like a water balloon. If you keep squeezing the neck of that balloon, which is what an enlarged prostate does to the urethra, it becomes harder to control the flow of water. In the early stages, these symptoms can be subtle, making them easy to dismiss as just a part of getting older or the result of drinking too much coffee. But as the condition progresses, the symptoms become more persistent and harder to ignore. As prostate cancer progresses, the bladder control problems can become more severe and more frequent. Men at this stage may experience constant urgency to urinate even when the bladder isn't full, a weak or interrupted urine stream, dribbling or leakage after urination, inability to completely empty the bladder, burning or painful urination. When you think of prostate cancer, the first symptoms that come to mind are usually related to urination issues or pelvic pain. But one of the less obvious yet equally important signs is unexplained weight loss and fatigue. This can be a critical warning sign that the cancer has progressed beyond the prostate and is starting to impact other parts of your body. Cancer, including prostate cancer, takes a significant toll on your body. It demands a lot of energy as it grows and spreads, essentially hijacking your body's resources to fuel its rapid cell division. This can lead to increased calorie burn. Cancer cells multiply quickly, using up more energy than normal cells. Muscle wasting. As your body tries to keep up with the energy demands of the tumor, it starts breaking down muscle tissue. Loss of appetite. Many cancer patients experience changes in taste and appetite, further contributing to weight loss. Chronic fatigue. The physical and emotional toll of fighting cancer can leave you feeling constantly drained. Dr. James East, a leading oncologist at the Mayo Clinic, explains it this way: cancer is like a parasite. It takes what it needs from your body without giving anything back. Over time, this can leave you feeling exhausted and undernourished even if you're eating normally. In the early stages, the weight loss might be subtle, just a few pounds here and there, but it's often one of the first signs that something is wrong. You might also notice that you feel tired more often even after a good night's sleep. As prostate cancer progresses, the fatigue can become more pronounced and more constant. You might start to notice extreme tiredness even after a full night's sleep, difficulty concentrating or focusing, muscle weakness and loss of stamina, frequent shortness of breath, to reduce your risk of developing prostate cancer in the first place. Consider regular PSA screenings and DREs, digital rectal exams, maintaining a healthy weight, eating a diet rich in fruits, vegetables, and lean proteins, exercising regularly, avoiding smoking and excessive alcohol consumption. All right, if you're still here, that means you're taking a crucial step toward taking control of your health. And that's a big deal because prostate cancer is beatable, but only if you catch it early. So if you've noticed frequent nighttime urination, weak urine flow, blood in your urine or semen, erectile dysfunction, pelvic pain, loss of bladder control, or unexplained weight loss and fatigue, don't ignore it. Get checked, stay informed, take action. Because at the end of the day, your life, your family, and your future are worth it. If you found this video helpful, hit the like button, share it with someone who needs to see it, and subscribe for more straightforward, life-saving health tips. Stay healthy, stay strong, and as always, thanks for spending a few minutes with us here at Sit Here with Teenagers.